Allison, and for my checkup, I'll be doing IV piggyback administration. So before I go into the patient's room, I'll be in the med room. So I want to verify that there's doctor's orders to prescribe to give the med first. So with any medication, I'm going to be checking my 5 routes. So right patient, right drug, right time, right route, and right dose. Yeah. So, okay, and so it's a pediatric patient. I would look in my drug book, making sure that it's in the safe dose range for the patient based on their weight, and also if the ordered dose exceeds the final max concentration, then I would need to calculate how much I would need to dilute my medication in. So the formula for that is just the dose over the final max concentration, and that gives you how much you need to dilute it in. Okay, and I also want to verify that the patient doesn't have any allergies to the medication that I will be giving them. Okay, and so this is just my medication. So I want to make sure that I have my medication bag labeled with the name of the drug, the dose, the time, and the volume to be infused. And tubing also make sure that it's labeled with my initials, the date, and the time, and it's good for 24 hours. Okay, and so, hi, my name is Allison. I'll be your nurse for today. So, can I get your first and last name and your date of birth? Okay. And if the child was too young, I could utilize the parent and ask them to verify the name and the birth date. So before I start, I just want to explain to the parent, if they're there, or if to the child in simple terms, if they can understand what medication I'll be giving them and how I'll be giving it to them. So I don't know, let's just say for example I'm giving them Vanco, maybe for to treat a urinary tract infection. Okay. So I would already have my primary bag set up, running with like normal saline already, and it would be running. Okay. And then for this purpose, it's just disconnected because I'm going to check the patency of my IV line. So while I'm doing that, I'm also assessing the IV site. So I'm looking if the IV, if there's any swelling, pain, or redness around the site, but this looks good. Okay. So to test the patency, I'm just gonna flush the line a little bit. So I'm gonna use my alcohol pad and flush it up, clean it, friction for about 15 to 20 seconds. And then I would also let that dry for 15 to 20 seconds. Okay, 15 to 20 seconds are up. Take my flush and then I will connect it. Holding pressure, I'm just going to open this and use a push-pause method. So it looks like it's flushing. Okay. Close this. And if I could not feel any, if I felt resistance trying to flush the line, then I would not want to like try to force it, because it could mean that there's a clot and I would dislodge the clot. Okay. So now this would be my my secondary bag, so my medication. So I would hang it above my primary, fill up the drip chamber to about halfway, and then prime my line, get out all the air bubbles. Okay. And then, so I would connect my piggyback to the correct port, which is just the port below the primary bag line. And then I would also disinfect this for 15 to 20 seconds. Okay. and then let that dry for 15 to 20 seconds too. So it's dry, so I can go ahead and connect my line. Okay. This would already be connected for the patient, but I was just showing you how to test for patency. Okay. Okay. So I have everything ready. I also want to make sure that I have my primary bag labeled too, with the name, the dose, and the time that I started it, and my initials, and also have this tubing labeled too. It's also good for 24 hours. Okay. And then so I would just turn on my machine. Okay. Okay. And then hook it up, and then okay. Okay, so it's pretty inside. Okay, there we go. Okay, and then I would set my rate depending on what the doctor ordered, how much he wants it to go over. So I don't know, if like 60 milliliters or 50 milliliters over an hour. Then I would also look at my volume to be infused in the bag, making sure that I include the flush for this. So IV piggyback, I would include a 20 ml flush. If I was antegrating, it would be different. So I would just add 20 to my 250 ml bag. So my volume to be infused would be 300, and then the rate I can set it at 50, and then start it, and then open up all of my clamps, and then let it run, and then I would document.